What is the best way to integrate pharmacology, physiology, and pathology? Imagine trying to solve a puzzle with pieces from different boxes. That's what learning pharmacology, physiology, and pathology can feel like at first. But when you connect these pieces, the picture becomes clear. During your first and second years in medical school, it's all about building a strong foundation. Physiology explains how the body works in health. Pathology shows what happens when things go wrong. Pharmacology teaches how drugs can fix or manage these problems. These subjects are like different sides of the same coin. Understanding one helps you understand the others better. Start by mastering normal physiology. Know how the heart pumps blood, how the kidneys filter waste, and how nerves send signals. This knowledge sets the stage for recognizing abnormal conditions. Then, learn pathology, which shows how these normal processes break down in disease. For example, in high blood pressure, the blood vessels become stiff, and the heart has to work harder. Seeing how disease changes normal function helps you understand symptoms and signs. Now, bring in pharmacology. It builds on what you know about physiology and pathology. For instance, drugs like beta blockers slow down the heart in high blood pressure. To understand how they work, you need to know how the heart normally functions and what goes wrong in hypertension. The best way to connect these subjects is through integrated learning. Many medical schools now teach these topics together, focusing on specific diseases or organ systems. For example, when studying diabetes, you review how the body normally handles glucose, what goes wrong in diabetes, and how insulin or metformin helps. This approach makes the material more meaningful and easier to remember. Active learning methods are especially helpful. Working through clinical cases like a patient with high blood pressure forces you to think about physiology, pathology, and pharmacology all at once. You might explain how blood pressure is regulated, what causes hypertension, and how medications help control it. Discussing cases with classmates also boosts understanding. It's like practicing real-life scenarios, which prepares you for clinical practice. Self-study is important too. Use textbooks, online resources, and practice questions to review mechanisms. Focus on understanding why drugs work, how diseases develop, and what changes happen in the body. Early clinical exposure can make a big difference. Even observing patient interactions or participating in simulations helps connect theory to practice. Seeing how drugs are prescribed and how diseases present in real patients makes the learning stick. To sum it up, the best way to integrate pharmacology, physiology, and pathology is to study them together in the context of diseases. Use active learning, work with classmates, focus on mechanisms, and seek early clinical experiences. This method builds a solid foundation that will support your future clinical work and make learning more engaging.